Low sperm count, what it means, why it happens, and what you can do about it. In the realm of reproduction, numbers count, literally. When a man's semen contains fewer than 15 million sperm per milliliter, it's considered a low sperm count, a condition also known as oligospermia. If there's no sperm at all, that's azoospermia. While these terms may sound like space-age jargon, their real-world impact is grounded and deeply personal, particularly for couples trying to conceive. The quiet clue, symptoms you might not notice. The most telling sign of a low sperm count is, quite simply, trouble starting a pregnancy. Most men with the condition don't experience other obvious symptoms, but when a low count stems from a health issue, other warning signs can appear, such as trouble getting or maintaining an erection, erectile dysfunction, reduced sexual desire, pain, swelling, or a lump in the testicles, decreased body or facial hair, which could signal hormonal or chromosomal imbalances. If you and your partner have been trying for a year with no luck, it's time to see a doctor. Don't wait that long if you have additional symptoms, past surgeries, or known medical conditions that could affect fertility. Fertility 101, how sperm is made. Sperm production is a complex process. The brain, specifically the hypothalamus and pituitary gland, must send the right hormonal signals to the testicles, which then produce sperm. These sperm travel through a maze of tubes to mix with semen and exit the body during ejaculation. When any part of this process breaks down, sperm count can drop. Even when sperm are present, problems with their shape or movement can reduce fertility. Sometimes, the exact cause of low sperm count remains a mystery. Behind the numbers, common causes of low sperm count. A variety of medical issues can interfere with sperm production or delivery. Here are some of the key culprits. Varicocele. Enlarged veins in the scrotum can raise the temperature around the testicles, which may harm sperm production. Surgery can sometimes improve sperm quality. Infections, from sexually transmitted diseases to viral inflammation of the testicles. Infections can reduce sperm count directly or cause scarring that blocks sperm flow. Ejaculation problems. In some men, semen travels backward into the bladder instead of exiting the penis, a condition known as retrograde ejaculation. Diabetes, certain medications, and surgeries can cause this. Tumors, cancerous or benign growths in reproductive organs or hormone-producing glands can disrupt sperm production. Treatments like chemotherapy or radiation may worsen the issue. Undescended testicles. If one or both testicles didn't descend into the scrotum at birth, fertility problems often follow in adulthood. Hormonal imbalances, issues in the thyroid, adrenal glands, or brain can alter the delicate hormonal mix needed for sperm production. Blocked tubes, physical obstructions, from injuries, infections, or congenital conditions like cystic fibrosis, can prevent sperm from reaching the semen. Genetic disorders. Conditions such as Klinefelter syndrome or Kallman syndrome can affect the way reproductive organs develop and function. Even medical treatments can inadvertently reduce sperm count. These include medications for cancer, high blood pressure, depression, and infections, as well as surgeries involving the prostate, testicles, or lower abdomen. Fortunately, surgical techniques sometimes allow sperm retrieval directly from the source. Environmental and lifestyle triggers. Modern life isn't always friendly to sperm. Exposure to industrial chemicals, heavy metals like lead or radiation can significantly impair sperm health. Even something as simple as too much heat around the scrotum, from saunas to tight clothing, can make a difference. Everyday habits also matter. Drug use, anabolic steroids, and recreational drugs like cocaine or marijuana can lower sperm production. Alcohol and smoking, these can reduce testosterone levels and sperm quality. Obesity, excess weight disrupts hormones and raises body temperature, both of which can impact fertility. Stress, chronic stress, especially related to fertility, can harm sperm count. And sometimes the issue lies with the testing itself. A sample collected too soon after the last ejaculation, during illness, or handled improperly can skew results. That's why sperm analysis is usually done more than once. The risks and roadblocks. Low sperm count doesn't just affect fertility. It can bring emotional and financial stress, especially if couples turn to advanced treatments like IVF. Some may require surgery to fix an underlying cause. For others, infertility remains unexplained and unresolved. Boosting the odds, prevention, and protection. While you can't change your genes, you can take steps to protect your fertility. Say no to smoking, excess alcohol, and recreational drugs. Maintain a healthy weight and diet. Avoid exposure to toxins and heat. Don't ignore persistent stress. Mental health matters. Review medications with your doctor for any hidden fertility side effects. Low sperm count isn't a dead end, it's a detour. With the right medical support, lifestyle changes, and sometimes a little science, many men with low sperm counts still become fathers.